The security guard never saw it coming. One second he was standing at the ICU entrance, clipboard in hand, coffee going cold in his thermos. The next second, 240 pounds of muscle and fury picked him up by the collar and threw him sideways into the wall like he was made of paper. The man didn't shout. He didn't threaten. His eyes were locked straight ahead, fixed on the glass partition like nothing in the world existed except whatever was on the other side of it. The second guard reached for his radio, and a massive hand closed around his wrist and squeezed until he dropped it. No words, no hesitation, just forward momentum and a kind of rage so quiet it was somehow worse than screaming. Before you go any further, if this kind of story moves you, please subscribe to the channel and follow along until the very end. And drop a comment telling me what city you're watching from. I want to see how far this story travels. Now, let's go back to the beginning. The call came in at 6:47 in the morning. Not the call about the man, the call about the woman. Her name was Elena Reyes, 38 years old. She had been brought into St. Mercy Hospital by ambulance 17 minutes earlier, unconscious, blood pressure dropping, her body doing something that none of the paramedics on scene could fully explain. One of them had used the phrase systemic shutdown into his radio, which was the kind of language that made the ICU nursing staff move fast and stop asking questions. Ava Hart was already on her fourth hour of a 12-hour shift when the gurney came through the double doors. She was not supposed to be the primary nurse on this case. She was supposed to be checking medication charts on the far end of the ward, the kind of quiet morning work that let her brain coast a little after a brutal overnight. But the moment the gurney rolled past her, something made her turn around. Maybe it was the way the lead paramedic was talking too fast. Maybe it was the particular shade of gray in the woman's face, that waxy stillness that Ava had seen before in places she didn't talk about anymore. Whatever it was, she followed the gurney through the doors without being asked. "What are we looking at?" she said, falling into step beside Dr. Brennan, the attending physician on duty that morning. Brennan was 53, silver-haired, the kind of doctor who had seen so much that almost nothing registered on his face anymore. He glanced at Ava sideways. "Reyes, Elena, possible cardiac event, possibly something else. We're figuring it out. BP, 70/40 when they brought her in. They got it up to 85 on the way here." Ava looked at the woman on the gurney. "That's not a cardiac event." Brennan stopped walking. He turned to look at her fully, the way people turn when someone junior says something they weren't expecting. "Excuse me?" Ava had learned, over the years, to read the temperature in a room before she said what she actually thought. She read it now. Brennan was not a bad doctor. He was a tired doctor, which was different, but not always better. She kept her voice even. Her color, the distribution of it, and look at her hands. She gestured without touching. The modeling stops at the wrist. That pattern is more consistent with a vascular event than cardiac. Has anyone run a D-dimer? Brennan looked at the hands. He looked at them for a moment longer than he probably intended to. "Get her set up in Bay 4, he said, which was not an answer to her question but was, she knew, as close to acknowledgement as she was likely to get right then. She went with Elena Reyes to Bay 4. That was the beginning of everything that came after. The ICU at St. Mercy was a controlled environment. That was the thing people didn't understand about it until they worked there. It wasn't quiet exactly, but it had a rhythm. Monitors beeping in overlapping patterns, the hiss of ventilators, the soft squeak of shoes on linoleum, nurses speaking in low, clipped sentences. Every person in that room understood their role in the rhythm. That was what made it possible to function. That was what made it possible to save lives without coming apart yourself. At 9:22 in the morning, that rhythm broke. Ava heard it before she saw it. She was at the nursing station, updating Elena Reyes' chart, when she heard a sound from the direction of the main corridor that she could only describe later as wrong. Not loud, not yet, but wrong. Like a frequency that didn't belong in the building. She stood up. Down the corridor, at the security checkpoint outside the ICU entrance, a man was standing at the desk. He was enormous. That was the first thing she registered, the sheer physical scale of him. 6'4" at least, wide across the shoulders in a way that made the security desk look like a piece of children's furniture. He was wearing jeans and a dark gray t-shirt, and his arms were crossed over his chest, and he was speaking to the guard on duty in a voice that was low and controlled, and somehow, from 40 feet away, still made the hair on Ava's arms stand up. She couldn't hear what he was saying. She could see the guard's response, which was the particular stiff posture of someone who was trying to appear in control of a situation they were rapidly losing control of. The second guard stepped up beside the first one. The man's eyes moved to the second guard, assessed him, and moved back to the first. He uncrossed his arms. "Don't," Ava said quietly, to nobody in particular. She was already moving. She wasn't fast enough. What happened next took approximately 4 seconds. It was the kind of 4 seconds that stretches in memory, that you replay later trying to find the point where you could have changed the outcome. The first guard reached out to put a hand on the man's shoulder, and the man's response was not violent exactly. It was something more efficient than violence. A redirection, a removal of obstacles, and suddenly the guard was on the floor, and the second guard was against the wall, and the man was walking through the checkpoint like it wasn't there. Several people in the corridor froze. A visitor grabbed his wife's arm. A young orderly with a cart of towels pressed himself against the wall. The man walked straight toward the ICU bay windows. He stopped at the glass. On the other side, through the wide window of Bay 4, Elena Reyes lay in the bed, monitors attached, an oxygen mask over her face, her chest rising and falling in the shallow, uncertain way that made Ava's stomach tighten every time she looked at it. The man pressed one hand flat against the glass. Something happened to his face then. Ava was close enough to see it. Whatever the expression was, it was not rage anymore. It was something underneath rage, something rawer and older, the expression of a person watching something slip away from them and understanding, for the first time, that they cannot stop it with their hands. Behind him, the 2 security guards were getting back to their feet. One of them had his radio out. The other was reaching for what Ava recognized as a taser. "Stop," she said. It came out quieter than she intended, but both guards stopped. Maybe it was her tone. Maybe it was the fact that she had stepped directly between them and the man. Maybe it was something else. "Ma'am, step aside," the taser guard said. "He assaulted too." "I see that," she kept her voice level. "Give me 2 minutes. This man needs to be—" "I said, give me 2 minutes." She turned to look at the guard fully, and something in her expression made him pause. "Please, stand back. 2 minutes." The guards looked at each other. One of them said something into his radio. Ava turned back to the man at the glass before they could change their minds. She walked up beside him. She did not announce herself. She did not say his name because she didn't know his name yet. She did not touch him. She stood beside him at the glass, close enough that he could see her in his peripheral vision. And she looked at Elena Reyes through the window for a moment before she spoke. "She's still fighting," Ava said. The man's hand was still flat against the glass. His breathing was audible, controlled in the way that people control their breathing when they are trying very hard not to come apart in public. He didn't answer. "The monitors would tell us if she wasn't." Ava kept her voice soft, even, like she was talking someone down from a ledge, which, in a sense, she was. "Her pressure's been stable for the last 40 minutes. That's good. That's actually really good, given where she was 2 hours ago." The man turned his head slightly. He wasn't looking at Ava. He was still looking through the glass, but she could tell he was hearing her. "Who are you?" His voice was low. It sounded like it was coming from somewhere far down, deep in his chest. "My name is Ava Hart. I'm one of the nurses on her care team." A pause. "And you're her husband." It wasn't a question. She could see it in the way he stood at that glass. The particular angle of possession and terror. The way a person stands when they are looking at something they cannot bear to lose. He nodded once, barely. They wouldn't let me in, he said. I know. I've been here since. He stopped, pressed harder against the glass, like he could push through it. Nobody would tell me anything. They kept saying I had to wait. I waited for 3 hours. He stopped again. Ava watched his jaw tighten. She watched the muscles in his neck cord up. She watched him try to hold on to the controlled breathing and start to lose it. And then she saw his arm. The tattoo. Black ink just below the inside of his elbow. A trident with the distinctive design she had memorized years ago. Not from textbooks, but from field manuals and bunkmates, and the particular dark humor of people who work in places where everything is trying to kill them. A Navy SEAL insignia. The Budweiser, they called it in the teams. She filed that information away in a particular corner of her mind, a corner that had been closed for a long time and opened very rarely. Can you tell me your name? She said. Mark. A beat. Mark Reyes. Mark. She said it the way you say someone's name when you want them to hear it. Not just the word, but the fact of it, the acknowledgement. Can you look at me for a second? He turned. She had been a field medic in the Gulf War. She had seen a lot of faces in a lot of conditions, and she had learned, years before she became a nurse in a hospital, how to read what was happening inside a person from what their face was doing. She looked at Mark Reyes now, and she read him the way she had been trained to read a situation. He was dissociating. Not fully, not yet, but the edges were fraying. His eyes had that particular quality, focused and unfocused at the same time, that she recognized from soldiers who were physically present in one place while their nervous systems were somewhere else entirely. The waiting, the helplessness, the physical size of his grief had tripped something in his brain that the brain, in its particular way, had tried to protect him from. It was pulling him backward, into somewhere older and louder and darker than a hospital corridor. She had about 90 seconds before she lost him. Mark, she said. His eyes moved to her face. Good. She held his gaze. I need you to stay with me right now, right here in this building. Can you do that? His brow furrowed slightly. Confused. That was actually a good sign. Confusion meant he was still accessible. What? Stay here with me. Look at my face. She kept her voice completely steady. You're at St. Mercy Hospital. Your wife is in Bay 4. She's on a monitor. The monitor is beeping. Can you hear it? He went very still. She could see him listening for the beeping. Through the glass, through the ambient sounds of the ICU, the monitors in Bay 4 were audible if you were quiet and paying attention. She watched his face as he found the sound. Something shifted in him. Not a collapse, not a recovery, something in between. Like a man who has been running for a very long time and has finally let himself stop, just for a moment, just long enough to understand where he is. His shoulder dropped. Not much. An inch maybe, but it was there. The beeping means her heart is beating, Ava said quietly. As long as you can hear it, she's still here. Mark Reyes pressed the back of his hand to his mouth. His eyes closed for 1 second, 2, 3. When they opened again, they were wet, but they were clearer. They wouldn't tell me anything, he said again. And this time it wasn't a statement of rage. It was a statement of exhaustion, of the particular helplessness of being someone who is used to solving problems and finding a problem they cannot solve. I know, Ava said, and I'm going to fix that right now. But first I need you to take 1 step back from that window and take a breath. Can you do that for me? He looked at her for a moment like he was deciding something, like he was running some kind of internal calculation she couldn't fully see. Then he took 1 step back. Behind Ava, she could hear the guards starting to move forward again. Without turning around, she put her hand out, palm back, a gesture that said, "Stop," as clearly as any word. Remarkably, they stopped. "Thank you," she said to Mark. "Now, will you come with me?" He glanced at the glass, at Elena. The monitors were still beeping. Where? Right there. She gestured to a small alcove just off the main corridor, the kind of semi-private space the hospital used for difficult family conversations. I'm going to tell you everything I know about your wife's condition, and I'm going to help you figure out how to be here in a way that doesn't get you removed from the building. Because she's going to need you when she wakes up, and I need you to still be in this building when that happens. The word when landed in the silence between them. He heard it. She could see him hear it. When, he said. When, she repeated, firm, no hedging, no false comfort, just a deliberate choice of word that meant exactly what she intended it to mean. Mark Reyes looked at the glass one more time. He looked at his wife's chest rising and falling. He looked at the monitors. He looked at Ava. And then, moving slowly, like a man who has been carrying something very heavy for a very long time and is only now beginning to understand how heavy it was, he walked toward the alcove. The guards started to follow. Ava turned around. "I've got this," she said. "Ma'am, he assaulted two of our—" "I know, and I'll take full responsibility for the next 20 minutes. I need you to give me that." She looked at the one with the radio. "Please, call it in if you need to, but give me 20 minutes. Another exchange of looks between them. She could see the calculation happening, the weighing of protocol against practicality, the fundamental human reluctance to escalate a situation that seems to be de-escalating. The guard with the radio spoke into it. She couldn't hear what he said. Then he lowered it and nodded at her, once, with the particular expression of someone who is allowing something they are not entirely comfortable allowing. She turned back to the alcove. Mark was sitting in one of the chairs. He had his elbows on his knees and his hands clasped together and his head bowed slightly. And he looked, in that position, less like a force of nature and more like a man at the end of something. He looked like a man in a church, Ava thought, which was a strange thought to have but was also somehow exactly right. She sat across from him. "How long has she been here?" he said without looking up. "She came in around 6:30. She was unconscious when the ambulance arrived." "What happened to her?" This was the question he'd been asking for hours, probably, in the waiting room where nobody would talk to him, and at the checkpoint where the guards had tried to hold him, and at the window where he'd pressed his hand against the glass. The thing he needed more than anything was the thing nobody had given him, which was the simple, honest, unvarnished answer. Ava sat forward in her chair. "We're still working on the exact diagnosis," she said, "and I want to be honest with you about that, because you deserve honesty. What we know is that her blood pressure dropped significantly before she got here, and her vascular presentation suggests something in that system is under stress. We're running tests, but she's stable right now, and her vitals are holding, and the team working on her is good." Mark raised his head. "But," he said. She looked at him. "There is a but. Say it. I think there's something the current diagnostic approach is missing, and I've raised it with the attending physician, and he's considering it." She chose her words carefully. "I'm not the most senior person in that room, but I've seen this presentation before, in different circumstances, but the same presentation, and I want to make sure we're not missing something important." He studied her. That was the word for it, studied. The way someone looks at you when they are trying to determine whether you are telling them the truth or telling them what they want to hear. "You've seen this before," he said. "Where?" And there it was, the question under the question, the one that would start to open things up. Ava looked back at him without flinching. "That's a longer answer," she said, "and we'll get there. But right now I need you to trust me for about 10 minutes while I go back in there and make sure your wife gets what she needs. Can you do that?" He was quiet for a moment. "You said when," he said. "Before, you said when she wakes up." "I did." "You meant it?" "I don't say things I don't mean." He held her gaze for a long moment. Then he nodded. It was a small movement, but it carried a weight she recognized. The weight of a person who is not accustomed to putting their trust in strangers and is choosing to do it anyway because they are out of other options. 10 minutes, he said. 10 minutes, she said. Don't go anywhere. She stood up. She walked out of the alcove and back down the corridor toward Bay 4. And as she pushed through the door into the ICU, she felt the familiar sensation of stepping across a threshold. The shift in the air, the change in the rhythm of the room. Elena Reyes was still breathing. The monitors were still beeping. And somewhere in the back of Ava Hart's mind, a very old set of instincts had come fully awake, shaken loose by a tattoo and a man's particular silence. And they were telling her that the next 30 minutes were going to determine everything. She went to find Dr. Brennan. Dr. Brennan was standing at the nurse's station with a tablet in his hand and the particular look on his face that Ava had come to recognize over the past 4 hours. The look of a man who was competent and careful and had already made up his mind. That look was dangerous in a diagnostic setting. She had learned that in the Gulf, long before she ever set foot in a civilian hospital. A closed mind in a fast-moving situation was just as deadly as the wrong medication. Dr. Brennan, she said, keeping her voice low, keeping it out of the earshot of the 2 nurses charting at the far end of the station. I need 2 minutes. He didn't look up from the tablet. The husband's situation resolved? For now, he's in the family alcove. He's calm. That made him look up. She could see the surprise move across his face before he controlled it. You got him to stand down? Yes, but that's not what I need to talk to you about. She stepped closer. Elena Reyes, the D-dimer. We ran it. And? He set the tablet down. Elevated, but not dramatically. Not enough to. Combined with the modeling pattern and the BP trajectory, it's enough. She kept her voice even, but she leaned in slightly because she needed him to hear this next part. She presented unconscious with a BP of 70/40. That's not a simple cardiac event. I've seen this before. The distribution of the modeling, the risk cutoff, the rate of pressure drop on transport, this looks like an arterial occlusion, possibly mesenteric. Brennan was quiet for a moment. A real moment of quiet, not the dismissive kind. That's a significant call, he said. I know. You're a floor nurse, Hart. I know that too. She held his gaze. And I'm telling you anyway. He picked the tablet back up. She watched him scroll, watched his eyes move across the numbers, and she stood still and let him think, because she understood, from long experience, that sometimes the best thing you could do for a smart person was give them space to arrive at the right place on their own. Pushing too hard in this moment would make him defensive. Defensive doctors were worse than closed-minded ones. I'll order an abdominal CT, he said finally, not looking at her. Thank you. I'm not saying you're right. I understand. He walked away. Ava turned back toward Bay 4. Elena Reyes had not moved, of course. Patients in critical condition rarely moved in ways that were visible. The drama was internal, invisible, happening in the blood and the vessels and the oxygen levels on the monitors. But Ava stood at the foot of the bed for a moment and looked at her, really looked at her, the way she'd been trained years ago to look at a person and read what the surface was telling you about what was happening underneath. 38 years old, dark hair against the pillow, a face that, even unconscious, still carried some particular structure that made you think, in a different light, in a different room, this was a woman who laughed easily. There was a ring on her left hand, a plain gold band, and Ava looked at it for just 1 second before she moved to check the monitors. The oxygen saturation had dipped 2 points in the last 15 minutes. It wasn't a crisis number. It was a trend number. And trends were what you watched when you wanted to know where something was going before it got there. She adjusted the flow on the oxygen mask by a fraction and watched the number stabilize, then ticked upward by 1 point. Good. She documented it and went back to the nursing station to find the phlebotomy request form. She was 3 lines into the form when the alcove door opened. Mark Reyes stepped into the corridor. He was not moving with the same energy he'd had 40 minutes ago. The momentum that had taken down 2 security guards and cleared a checkpoint was gone, replaced by something more careful, more deliberate. He walked like a man who was choosing each step consciously, which was, Ava knew, actually a good sign. Conscious movement meant conscious thought. Conscious thought meant he was still present. He spotted her at the nurse's station and walked toward her. 10 minutes was up 8 minutes ago, he said. I got held up. She didn't apologize, and she didn't explain further. Come here, I'll tell you what's happening. He came to the station. He was too large for the space. He made everything around him look scaled wrong. But he stood still, and he kept his voice low. And those 2 things, she noted, were active choices. He was managing himself. That took real effort, and she recognized the effort for what it was. We're running a CT scan on Elena, she said. The attending physician ordered it about 5 minutes ago. It'll take about 20 minutes to get her down and back, and then we'll have more information. What are you looking for? A possible arterial issue. I don't want to give you a diagnosis before we have confirmation. Don't do that, he said quietly. The words were not aggressive, but they were firm. Don't manage me. I've had people manage me since I got to this building, and it's the reason 2 of your security guards are going to have bruises tomorrow. Tell me what you think is happening. She looked at him for a moment. Then she nodded. I think she has a blockage in one of the abdominal arteries. If I'm right, the CT will show it, and the team will be able to act on it quickly. If I'm wrong, the CT will rule it out, and we'll look at other options. She held his gaze. I think I'm right. He processed that. She watched him do it, watched the information move across his face, watched him sort it, file it, hold the fear down beneath the surface where he needed it to stay in order to function. What happens if the blockage doesn't get treated? He said. That's not the direction we're going. I asked you not to manage me. She took a breath. Untreated mesenteric occlusion can cause bowel ischemia. It's serious. It's also, if caught in time, treatable. Which is why I'm standing at this desk filling out these forms instead of sitting in a chair. Something moved behind his eyes. Not fear exactly, or not only fear. Something that recognized the information and accepted it in the particular way of people who have spent time in places where the difference between acting and waiting is the difference between someone living and someone dying. Okay, he said, low, steady. Okay, what do I do? And that right there, Ava thought, was the thing about this man that was worth paying attention to. Not the force he'd come in with, not the 2 guards he'd put on the floor, but this. The moment the door opened even slightly, he walked through it. He asked what he could do. That was not a small thing. That was actually a very large thing. Right now, you wait, she said. But you wait here, not in a waiting room on another floor where nobody talks to you. You sit in that chair by the window where you can see Bay 4, and you wait there, and I will personally come and get you the minute the CT results come back. That is my promise to you. He looked at the chair. He looked at the window. They're going to come back to arrest me, he said. The security guys. Probably. I'm going to talk to them first. She capped her pen. You threw 2 people into walls. I know. Is that something you want to talk about? The question landed between them. He didn't flinch from it, but he didn't answer it either. He looked at the chair again. Not right now, he said. Fair enough. She filed the phlebotomy request. Sit down, Mark. He sat down. She went to find the security team. The head of hospital security was a man named Dale Pruitt. He was 51, retired police, the kind of man who had been in enough physical confrontations in his life that he had zero interest in them anymore, and approached every potential escalation the way a bomb disposal technician approached a suspicious package, with great care and a strong preference for not blowing anything up. He was also, Ava had learned over 2 years at St. Mercy, a reasonable person which in her experience was rarer than people assumed. She found him in the security office off the main lobby and laid it out for him plainly. The husband, the waiting, the 3 hours of silence, the dissociation. She used that word deliberately and watched him register it. PTSD, Pruitt said. Almost certainly. The tattoo confirmed his background. His response to the situation was consistent with a trauma-triggered dissociative state. He was not fully in control of his actions in those first few minutes. He put Rodriguez into the wall hard enough to crack the drywall hard. I know, I'm not excusing it. I'm explaining it. She leaned forward. He's calm now. He's sitting outside Bay 4 waiting for news on his wife. He's not a threat. And if you send officers in there to arrest him right now, you are going to re-trigger a man who is managing himself by a thread. And the situation you get will be significantly worse than the one you just handled. Pruitt chewed the inside of his cheek. She had seen this expression before. It was his thinking face. My guys have to jigay an incident report, he said. Of course, and if he's in the building, he's technically a family member of a critical patient who has not left the premises and has not posed any further threat. She kept her voice even. Give him 2 hours, Dale. If the CT comes back the way I think it will, his wife is going to go into an emergency procedure, and he is going to need to be there. Let him be there. You can deal with the incident report afterward. Pruitt was quiet for a long moment. You're putting yourself in a difficult spot, Hart. That's my problem. It is, he agreed. He turned back to his desk. 2 hours. If anything else happens, I'm not going to be able to hold my guys back. Understood. Thank you. She walked back to the ICU. The CT had already been ordered. Elena Reyes was being prepped for transport to imaging, which meant there were 2 minutes, maybe 3, before the bay went quiet and the waiting began. Ava used those 2 minutes to check the most recent vitals, to confirm the medication drip rate, and to stand at the head of the bed for just a moment and say, quietly, to a woman who could not hear her, "We're going to figure this out." She wasn't sure why she said it. It wasn't something she did habitually, but something about this case, about this woman and the man sitting in the chair outside, had gotten under her skin in a way she hadn't expected, and the words came out before she could make a decision about them. The transport team came in. The gurney moved. Bay 4 went quiet. Ava walked back to the window. Mark was sitting exactly where she'd left him, elbows on knees, hands clasped, head slightly bowed. He looked up when she appeared at the window, and she gave him a small nod. Still going, still working, hold on. And he nodded back. She went to the nursing station and picked up a cup of coffee that had gone cold and drank it anyway. The next 18 minutes were the kind of minutes that expanded, that stretched, that filled themselves up with small movements and quiet sounds, while the important thing was happening somewhere else in the building, in a machine that would answer the question she needed answered. At 10:41 in the morning, Dr. Brennan walked back through the ICU doors with his tablet in his hand and a look on his face that Ava recognized immediately. She was right. She knew she was right before he said a word, because she knew that look. She had seen it before, on other doctors in other places. It was the look of a man who had just seen something on a screen that confirmed something he hadn't fully believed until the screen made him. Mesenteric arterial occlusion, Brennan said, stopping at the station. He turned the tablet toward her. She looked at the image without touching it. Partial, but significant. You were right. What's the plan? Interventional radiology. We need to get a vascular surgeon in here. He was already dialing. We're going to attempt catheter-directed thrombolysis. If that's not enough, she may need surgery. Time frame? We want her in the IR suite within the hour. I'm calling Dr. Kwan now. He looked at her over the tablet. Good call, Hart. Those 2 words landed in her chest in a way she didn't have time to examine right now. She filed them away and turned toward the window. Mark was still in the chair, still watching. She walked to the alcove doorway. We have the results, she said. He stood up immediately. Tell me. I was right about the blockage. The vascular team is being called in now. They're going to go in and clear it. It's a catheter procedure, which means no open surgery unless they encounter complications. She's going to go into an interventional suite within the hour. He stood very still. He was processing. She let him. Complications, he said. What kind of complications? The kind that are possible in any procedure and that I don't want to speculate about because the most likely outcome is that this goes well. The team they're calling is excellent. Dr. Kwan has done this procedure more times than I can count. She stepped slightly closer. Mark, look at me. He looked at her. She got here in time, Ava said. That matters. Every minute matters with this kind of occlusion. And she got here in time. Okay? His throat moved. He nodded. Okay, he said. The word barely made it out. I need to go back in there to help prep, she said. But I want to ask you something first. He waited. When they take her to the IR suite, you'll be asked to wait in a surgical waiting area. It's going to be at least 2 hours, probably longer. I need you to tell me right now, honestly, whether you can do that. Sit in a waiting room for 2 hours. The question was direct and deliberate, and she watched him understand exactly why she was asking it. His jaw tightened. You're asking if I'll lose it again. I'm asking if you have what you need to hold on. That's different. He was quiet, really quiet, in the way of people doing genuine internal accounting. I've sat in worse places for longer, he said finally. I know you have, she held his gaze. But were you alone? That hit him. She could see it hit him, could see something move across his face that was not pain exactly, but was close to it, the recognition of something true. My brother, he said. I can call my brother. Call him now, before they move her, so he can be here before she goes in. He reached for his phone. She went back into the bay. The next 40 minutes were controlled chaos in the good way, the productive way, the kind of organized forward movement that Ava had trained for and functioned best in. Elena Reyes came back from imaging, and the radiology report was already in the system, and Dr. Kwan arrived 22 minutes after Brennan's call, which was fast even by his standards. And she understood immediately that Brennan had conveyed urgency accurately. Kwan was 50, Korean-American, compact and precise, the kind of surgeon who made you feel safer the moment she walked into a room, not because she was warm, but because she was absolutely, completely, unshakably competent. She reviewed the images, she reviewed the chart, and then she looked up and said, "Who called this?" Brennan gestured toward Ava. Kwan looked at her, assessed her in one quick second, in the way that very good doctors assessed people, looking for the thing beneath the surface. Floor nurse? Kwan said. Yes. What made you look at the vasculature? The mottling distribution, Ava said, and the pressure drop rate. The cardiac explanation didn't fit the pattern. Kwan nodded once. Good eye. She turned back to the table. Let's get her prepped. It was not effusive praise, but from Dr. Kwan, that two-word response meant something real, and every nurse in the room knew it. Elena Reyes was prepped and moved GGKR suite at 11:17 in the morning. Mark was in the corridor when the gurney came through. He had his phone in his hand, and a man standing beside him who looked like a younger, slightly less massive version of himself. And when the gurney came through the doors, he stepped forward and reached out and touched his wife's hand for exactly 3 seconds before the transport team had to keep moving. I'm here, he said, to her, to the unconscious woman on the gurney who could not hear him. I'm right here, Elena. The gurney passed him. He watched it go. Ava was at the back of the transport team. She paused when she reached him. 2 hours, she said quietly. Waiting area is on the 2nd floor. I'll send word the moment I have anything. He nodded. He looked wrecked and grounded at the same time, which was the particular combination of a person who has been through the worst part and is choosing to survive it. Heart, he said. She stopped. "Thank you," he said. She held his gaze for one moment. "Save it for when she's out," she said. She kept walking. Behind her, she heard his brother say something in a low voice, something she couldn't make out, and she heard Mark respond, and then the sound of the double doors closing behind her. And then there was only the sound of the IR suite preparation team, and the monitors, and her own heart steadying itself for the next 2 hours. She had done the things she came here to do. She had flagged the occlusion. She had gotten Brennan to order the scan. She had managed the situation with Mark well enough that the security team had stood down and he had been able to see his wife before surgery. But she was not naive enough to think the hard part was over. Procedures went wrong. Complications happened. 2 hours was a long time, and she had learned in places far bloodier and louder than this hospital corridor that anything could happen in 2 hours. She scrubbed in and followed the team through the door. She did not look back. The IR suite was cold the way all procedural rooms were cold, and Ava had long since stopped noticing it. What she noticed instead were the hands. Dr. Kwan's hands moving with that particular precision that separated good surgeons from extraordinary ones. Steady and deliberate. No wasted motion, no hesitation. The kind of hands you wanted working on someone you cared about. Ava stood at the secondary monitoring station. Her role in this procedure not surgical, but observational. The extra set of eyes that track vitals, while the primary team focused on the catheter work. It was not a glamorous position. It was, however, an essential one. And she had asked to be here, and Dr. Kwan had not objected, which Ava took as a form of permission. Elena Reyes's pressure had stabilized at 90/60 before they started. Not strong, but workable. The anesthesiologist, a quiet man named Dr. Petrov, who communicated almost entirely in small sounds and eyebrow movements, had gotten her sedated and comfortable, and the imaging screen showed the catheter moving through the arterial pathway toward the blockage, with the slow, deliberate progress of something being done right. Kwan had not spoken in 4 minutes. In Ava's experience, that was actually a good sign. Surgeons talked when they were uncertain. They went quiet when they were working. Then the monitor to Ava's left changed. Not dramatically. Not the alarm-triggering drop that made everyone move at once. Something quieter, and therefore, to Ava's eyes, more concerning. A pattern shift in the cardiac rhythm. A series of small irregularities that individually meant nothing and together meant something she did not like. She looked at Petrov. He was already looking at the same monitor. "You seeing that?" she said low. "Seeing it," he said. "PVCs?" She kept her voice out of the surgical field, a reflex from years of learning not to put words into a room that would pull focus at the wrong moment. "Looks like," he adjusted something on his panel. "I'm watching it." She watched it with him. The irregularities continued, not worsening, not resolving, just persisting in that ambiguous middle territory that kept you alert and gave you nothing definitive to act on. She counted the pattern, counted it again. "Dr. Kwan," she said. Kwan did not look up from the imaging screen. "What is it, Hart?" "Cardiac rhythm showing intermittent PVCs. About 6 per minute, started approximately 90 seconds ago." A pause. Kwan's hands did not stop moving, but something in her posture shifted. "Petrov?" "Confirmed," Petrov said. "Watching it, not in a dangerous range yet." "Yet," Kwan said, which was not a question. "Monitoring closely." Ava watched the screen. The catheter was close now, close to the blockage, which meant they were at the most critical point in the procedure. The point where you least wanted a complication, and complications were most likely to announce themselves. It was the kind of irony that medical professionals learned to accept and never fully made peace with. The PVCs ticked up to 8 per minute. "Petrov," Ava said. "I see it. That's a trend. I know it's a trend, Hart. Not sharp, just factual." He was already adjusting his panel again. Kwan's hands paused for the first time, just for 1 second. Then they resumed. "Talk to me, people." Rhythm is showing a pattern, Petrov said. Could be stress response from the occlusion. Could be something the blockage has been doing to her system for longer than we knew. I'm adjusting the antiarrhythmic. How long has she had this blockage? Quan said. To the room, to anyone who could answer. Ava answered because she had been thinking about this since she first looked at Elena Reyes's chart. Given the pressure trajectory and the symptom onset based on ambulance report, at least 6 hours, possibly longer. Longer, Quan said, and the word was not a question, but a conclusion. The kind a surgeon reaches when the information aligns with what she's seeing on the screen. Petrov, if this is ischemic stress on the myocardium, then we may have more to deal with than the primary occlusion, he finished. I know. I'm managing it. The room went tight in the particular way of rooms where everyone understands the stakes, and no one wants to be the one to say them aloud. Ava kept her eyes on the monitor. She kept counting. The PVCs held at 8, then dropped to 5, then held at 5. She let out a breath she hadn't entirely known she was holding. Stabilizing, she said. Confirmed, Petrov said. Whatever that was, it's backing off. Quan's hands continued their work. I'm at the occlusion, she said. It was a simple statement of position, but it carried weight. The room went quieter. Beginning thrombolysis. Ava shifted her attention from the cardiac monitor to the procedural imaging screen. She was not a vascular surgeon. She did not have Dr. Quan's training or her decade of specialized experience, but she had been in enough procedural rooms, in enough different contexts, that she understood the broad shape of what she was watching. And what she was watching was a surgeon at the height of her craft, breaking apart a blockage that had been quietly trying to kill a 38-year-old woman since before 6 o'clock in the morning. It took 11 minutes. 11 minutes in which the room was almost completely silent, except for the monitors and the low exchange of technical language between Quan and her scrub tech. 11 minutes in which Ava stood at her station and watched every number on every screen and cataloged every small change and said nothing because there was nothing that needed to be said. And then, Doctor, Quan said, there it is. And the imaging screen showed the blood flow restoring through the artery, the grayness of the blockage giving way to the movement of contrast dye through a cleared pathway. And the monitor showed Elena's pressure beginning, slowly, carefully, to climb. 92/63, 95/65. Nice, Petrov said. From him, that was a standing ovation. Ava realized her hand was gripping the edge of the monitoring station. She let go of it. We're not done, Quan said, but her voice had changed. Not relaxed, never relaxed in a procedural setting, but something in it had shifted from acute crisis to controlled continuation. I want to run a full assessment of the arterial wall before we pull out. Heart, I want updated vitals every 90 seconds until we're clear. Understood. What happened in the next 20 minutes was the careful, methodical work of confirming that the thing you fixed stayed fixed, that the walls of the artery held, that the surrounding tissue responded the way it was supposed to respond, that the heart rhythm stayed clean and steady and did not return to that unsettling pattern of irregularities. It was tedious work and important work, and Ava did it without complaint, calling out numbers at 90-second intervals into the quiet of the room, her voice steady, her attention complete. Elena's pressure reached 102/68 before they closed. Quan stepped back from the table and stripped off her outer gloves. She looked at the imaging screen one final time, then at Ava. Good catch today, she said. It was the second time in 2 hours someone had said something like that to her. Both times the words had landed in a place in her chest that she hadn't been expecting them to land. Thank you for coming in fast, Ava said. Don't thank me. Thank whoever called it early enough that there was still something to fix. Quan turned to her scrub tech. Let's get her to recovery. I want monitoring every 30 minutes for the first 4 hours. Ava pulled off her own gloves and walked out of the IR suite. The corridor outside was ordinary, fluorescent light, linoleum floor. the distant sound of the hospital going about its business. Ava stood in it for a moment and just breathed. She had been running on a kind of controlled adrenaline for the last 4.5 hours, the particular state she knew how to operate in and had been operating in since she was 26 years old, in a field hospital with sand everywhere and not enough of anything. The adrenaline was starting to metabolize now, and what was left underneath it was something she didn't have a clean word for. Not relief, exactly, not satisfaction, something more complicated than either of those. The feeling of having done the thing and knowing the thing needed doing, and understanding that those two facts lined up in a way that didn't happen every day. She took the elevator to the second floor. The surgical waiting area was a room she had been in dozens of times from the other side of the equation, the side that delivered news. She had delivered good news in this room, and bad news, and news that was complicated enough that people's faces changed in ways that were hard to watch. She pushed through the door now and found Mark Reyes exactly where she expected to find him, in a chair near the window, his brother beside him, both of them sitting in that particular suspended stillness of people waiting for something they cannot control. Mark saw her before the door finished closing. He was on his feet before she had taken 3 steps into the room. She kept her face deliberately calm because she understood that the first expression he read on her face would tell him more than her first words. And she wanted to give him accurate information, not a performance of it. "She's out," Ava said. He stopped moving. "And?" The procedure worked. Dr. Kwan cleared the blockage. Elena's blood pressure is back in a functional range and holding. She's being moved to recovery right now. The sound he made was not a word. It was something underneath words. Something that came from a place in a person that language doesn't reach until it's ready to. His brother put a hand on his shoulder and Mark sat back down. Suddenly, like the scaffolding holding him up had just released pressure all at once. "There are monitoring requirements for the next several hours," Ava continued, keeping her voice steady because he needed steadiness right now, not emotion. "And Dr. Kwan will want to speak with you directly about what comes next. But the acute crisis is resolved. She came through it." "She came through it," he repeated, like the words needed to be said out loud, to be real. "Yes." His brother, whose name she still didn't know, leaned forward with his elbows on his knees and pressed his face into his hands for a moment. When he looked up, his eyes were wet, and he didn't try to hide it. Mark didn't cry. He sat very still and looked at some point on the floor between his feet, and did something internal that she recognized and respected. She had seen that particular internal work in soldiers, and in surgeons, and in parents in waiting rooms, and in people who had trained themselves to manage the very biggest feelings in the very smallest ways, because the alternative had never been available to them. "Can I see her?" he said. "Not yet. She's in recovery and they need about an hour before family visits. The nurse on the recovery floor will come get you." Ava sat down across from him. "I wanted to be the one to tell you myself." He raised his head. He looked at her. "Why?" It was a real question, not rhetorical. He wanted to understand. She thought about how to answer it honestly. "Because I made you a promise this morning," she said. "I said I'd send word the minute I had anything. And a promise is a promise." Something in his expression shifted. Not dramatically, just slightly, the way a face shifts when it hears something that matches a frequency it was looking for without knowing it. "You've been with her this whole time?" he said. "Since the beginning?" "Yes." "Why?" She considered him. "Because something told me to follow the gurney this morning. And in my experience, you follow those instincts." His brother was watching this exchange with an expression she couldn't fully read. He was younger than Mark, maybe 30, with the same broad shoulders but a softer face. The face of someone who had not been to the same places Mark had been. "I'm Danny," the brother said. "Danny Reyes. Ava Hart. Are you always like this?" he said. The question was genuine, not pointed. "Like what?" "Like," he searched for the word, "this calm, all the time." She thought about it. I learned to be. Where? Mark said. And there it was again, the same question as before, asked differently this time, with less urgency and more weight. The question that she had deferred earlier because there hadn't been time, and now there was time, and he had earned the answer. She looked at Mark Reyes. She looked at the trident tattoo on his forearm. She looked at the way he held himself even now, even in a waiting room chair after the worst morning of his adult life, with his spine straight and his shoulders back, the posture of a person for whom physical discipline was not effort, but habit. She had kept this part of herself quiet for a long time. Not hidden exactly, not ashamed of it, just contained. She had found that people in civilian settings did not always know how to hold the information, that it changed the way they looked at her in ways she found complicated. She had become, over the years, good at offering enough of the truth to be honest, without offering so much of it that it became a conversation she didn't want to have. But Mark Reyes was not a civilian audience, and she had been carrying this particular story alone for a long time. Gulf War, she said. Field medic, 2 deployments. The room changed, not physically, nothing moved, but something shifted in the air between them, the particular shift that happens when one person says something real to another person, and the other person recognizes its realness because they have lived somewhere adjacent to it. Mark went completely still. You were in the Gulf, he said. I was. As a medic? Yes. He stared at her. She watched him recalibrate, watched him reprocess the morning through this new information, watched him arrive at the understanding that the calm she'd shown, the specific knowledge she'd used, the way she'd spoken to him at that window, none of it had been textbook training. It had been experience. Real, unfiltered, you don't get this from a classroom experience. The phrase you used, he said slowly, at the window, when I was, he stopped. She waited. I don't remember everything from those first few minutes, he said. His voice was lower now. The admission cost him something, and she could hear it cost him. I know I hurt those guards. I know I was... He paused again, and the pause was full of something he didn't have words for. I wasn't here. I know. But then you said something, and it pulled me back. She nodded slowly. What was it? He said. What did you say? She studied his face. He genuinely didn't remember. That was consistent with what she knew about dissociative states, the way certain minutes could go dark in the memory, even while the body was still moving through them. I told you to stay, she said, to stay here in this building, and I asked you if you could hear the monitor. He was quiet. The beeping, he said, yes. Her heartbeat. Yes, something moved across his face that she did not look away from, even though it was a private thing, a raw thing, the kind of expression that appears on a person's face only in the moments when they have stopped performing, being okay, and are simply being what they are. It lasted only a few seconds. Then it passed, and his jaw set again, and he was back to the steadiness. That was a good call, he said quietly. It was the right tool for the right moment, she said. That's all. Danny had been very still during this exchange, listening. He spoke now, carefully. You knew about PTSD, he said to Ava, how to handle it, not from a textbook. It wasn't a question, it was a recognition. No, she said, not from a textbook. Mark looked at her with an expression she couldn't entirely categorize. It wasn't gratitude, though gratitude was in it. It wasn't recognition, though that was in it too. It was something more specific. The look of a person who has been alone in something for a long time and has just encountered, unexpectedly, someone else who has been in adjacent territory. How long have you been a nurse here? He said. 2 years. Before that? Different things. She kept it measured. I went back to school after my second deployment, got my nursing degree, worked in a VA hospital for 6 years, then here. VA, he said, and the weight of that single word told her he understood what a VA hospital was. Not abstractly, but concretely. from the receiving end. Yes, she said. He was quiet for a moment. Then he said, did you ever, after the deployments, did you ever have a hard time coming back? The question was direct and personal and came from a place in him that had nothing to do with small talk. She knew what he was really asking. She knew it because she had asked herself the same question in different words at different points over the last 30 years. She answered him honestly. Yes, she said, for a long time. He nodded. He looked at the floor. Does it get better? He said, still to the floor. She took a breath. She thought about the answer that would be comforting and the answer that would be true and found, as she usually did, that the truest answer was the one worth giving. It gets different, she said. You learn to carry it differently. The weight doesn't go away, but you get stronger, and the way you hold it changes. She paused. And you stop trying to carry it alone. That's the big one. That's the thing that makes the most difference. He raised his eyes to hers. The waiting room was quiet around them. Danny had leaned back in his chair and was looking at his hands. The fluorescent light was doing what fluorescent light always did. Somewhere outside the door, the hospital was continuing its ordered, necessary chaos. I have a therapist I stopped seeing, Mark said, about 8 months ago. What made you stop? A pause. I thought I was past it. She didn't say anything to that. She didn't need to. The morning had already made the argument for her more efficiently than any words she could choose. He heard his own words in the silence, and something in his face acknowledged what they meant. Yeah, he said quietly. There's a social worker on staff here, Ava said. She works with veterans specifically. Her name is Christine Bauer. She's excellent. She pulled a card from her scrub pocket. She had picked it up at the nurse's station an hour ago, almost without thinking, an instinct. She held it out. Whether you call her or not is your choice, but take it. He looked at the card. He took it. He looked at it for a moment, the small rectangle of it in his large hand, and then he put it in his jeans pocket without ceremony. Hart, he said. Yes? Does Brennan know? His eyes moved up to hers. About your background, the Gulf, the VA. She shook her head. Why not? She thought about that for a moment. The real answer was layered, and she chose the top layer, which was also the truest one. Because I'm a floor nurse, she said, and I've found that sometimes the information gets in the way of the work. He studied her. That's not the only reason. She looked back at him steadily. No, it's not. He didn't push further, which told her something about him, about the kind of person he was under the size and the rage and the grief of the morning. A person who understood where the edge of someone else's space was and chose not to cross it. Danny shifted in his chair. So what happens now? He said, directing the question at Ava. For Elena, what comes next? Recovery monitoring for the next 4 hours. Then Dr. Kwan will assess and give you a full picture of what the follow-up looks like. There may be medication adjustments. There may be some dietary protocols depending on what she finds. But the immediate crisis is over. Ava stood. The recovery floor nurse will come get you when Elena is ready for visitors. It shouldn't be more than another 45 minutes. Mark stood as well. Danny started to, and Mark put a hand on his shoulder, and he stayed seated. Mark walked Ava to the waiting room door. She stopped with her hand on the push bar and turned back to him. He was close. Up close, standing still, not in crisis, she could see the full measure of what the morning had taken out of him. The lines around his eyes, the set of exhaustion in his jaw, the particular grayness that settles on a person's face after hours of sustained fear. He looked like a man who had just come back from a very long way away and wasn't entirely sure yet what he'd return to. She doesn't know how sick she was, he said. It wasn't really directed at Ava. It was just a thing he needed to say out loud. No, Ava agreed. She'll need to hear that from you. How do you tell someone something like that? Carefully, she said, and honestly, and more than once, because people don't always take it in the first time. But you tell her. She looked at him. She needs to know what almost happened, not to frighten her, so she takes the follow-up seriously. He nodded slowly. And Mark, she said, yeah, she's also going to need to hear what this morning was like for you. Not just the facts of it, the whole of it. She held his gaze. Don't carry that alone either. He looked at her for a long moment. His throat moved. You're a strange person to meet in a hospital corridor, he said finally. She thought that was probably the most accurate description of her anyone had ever offered. Get some water, she said. You've been here for hours and you haven't had anything. She pushed through the door. The corridor outside was ordinary and bright and full of the hospital's ongoing momentum, and she walked into it and kept walking, and she did not look back, and the card she had been carrying in her pocket for the last hour, the one with Christine Bauer's name on it, had one she'd kept for herself for 6 months without calling. She thought about that as she walked. She thought about it for longer than she expected to. She had not eaten since 5:30 in the morning. That was the thought that found her somewhere between the second-floor elevator and the ICU corridor. A thought so mundane it almost made her laugh. 8 hours into the most complicated shift she'd had in 2 years at St. Mercy, and what her brain offered her in a moment of quiet was the memory of a granola bar eaten standing up in the parking garage before dawn. She stopped at the vending machine near the nurse's lounge and bought a pack of crackers and ate 3 of them in the corridor without tasting them and put the rest in her pocket. Then she went back to Bay 4. Bay 4 was quiet now. Elena's bed had not yet been returned from recovery, which meant the monitors were silent, and the room had that particular emptiness of a space waiting to be needed again. Ava stood in the doorway for a moment. She looked at the indentation in the pillow, the slight wrinkle in the sheet where Elena had lain for 3 hours while her body tried to quietly shut down. She looked at the window where Mark had pressed his hand against the glass. She turned away and went to the nurse's station. There were charts that needed updating. There were always charts that needed updating. She sat down and pulled up Elena's file and began working through the documentation with the methodical focus that good nursing required. The particular discipline of translating a morning of chaos into clean, accurate, legally defensible language. Administered at this time, vitals recorded at this time, physician notified at this time. It was important work and deeply unglamorous work, and she had made peace with that distinction long ago. She was 4 lines in when she heard her name. Hart, she looked up. Dr. Brennan was standing at the edge of the station. He had his tablet in his hand as always, but he was not looking at it. He was looking at her with an expression she had not seen on his face before, which was notable because she had cataloged most of his expressions over 2 years. Do you have a minute? He said. She saved the chart. Yes. He came around to her side of the station, which was itself unusual. Brennan was a man who maintained distance by habit, physical as well as professional, the way many senior physicians did, the distance that protected authority. Coming to her side of the desk was a deliberate closing of that distance, and she noted it. He pulled a chair over and sat down. She turned to face him. Quan called me after the procedure, he said. Okay. She told me what happened in the IR suite. The PVC pattern. The way you tracked it and flagged it before Petrov had fully articulated what he was seeing. He paused. She also told me what she thought about the original diagnostic call. Ava waited. She had learned that waiting was often more useful than speaking. I want to ask you something directly, Brennan said, and I want you to answer me directly. No hedging, no deference. Can you do that? I'll try. How did you know this morning, the mottling, the pressure trajectory? You looked at that woman for 45 seconds and you came to me with a specific call that turned out to be exactly right. How? The question was not accusatory. It was genuinely curious. And there was something underneath the curiosity, something she recognized as a kind of professional reckoning, a man of seniority and experience asking a junior colleague to explain how she saw something he hadn't seen. That took real self-awareness to ask, and she respected him for asking it. She thought about the careful answer and the true answer, and chose the true one. Pattern recognition, she said, but not from here. He waited. I was a field medic, 2 deployments in the Gulf, and then 6 years in a VA hospital after that. She held his gaze evenly. I've seen arterial occlusion present in the field. Without imaging, without a full diagnostic suite, you learn to read it from the surface when that's all you have. The silence that followed was the specific silence of a person recalibrating. Brennan set his tablet down on the desk beside him. He looked at her for a long moment. You were a combat medic, he said. Yes. And you've been working as a floor nurse for 2 years. Yes. He looked at the tablet. He looked back at her. Something moved across his face that she could not entirely read. Some internal process she wasn't fully privy to. Why didn't you say something? He said. When you hired on, your background wasn't relevant to the position I applied for, she said. Floor nurse, that's what I applied to be. It was relevant this morning. It was, that's true. She kept her voice even. But on most mornings it isn't. And on the mornings it is, I use it. She paused, which is what I did. Brennan was quiet. She could see him working through something, some adjustment in how he understood the morning and how he understood her and how those two things fit together. The husband, he said, you handled him. Yes. Security told me what happened at the checkpoint, and then they told me what happened after, that you walked up to a 240-pound man who just thrown 2 people into walls and talked him down in under 5 minutes. He looked at her directly. That wasn't nursing school either. No, she said, that wasn't nursing school. He nodded slowly. I owe you an apology, he said. She blinked. Of all the directions she had anticipated this conversation going, that was not one of them. For what? The D-dimer. His voice was measured, the tone of someone who is being precise because they want to be accurate, not because they are comfortable. You asked me about it, and I didn't answer you. And then when you came back with the full call, I said, that's a significant call, before I ordered the scan. What I should have said was, you're right, let's do it now. He paused. That hesitation cost time. We still got her there in time, Ava said. Barely. He held her gaze. I'm not going to pretend otherwise. Quan told me the occlusion was further progressed than she expected, given the presentation timeline. If you'd been less persistent, if you'd accepted my hesitation and let it go. He stopped. You understand what I'm saying. She did understand what he was saying. She had understood it clearly at the time and had chosen not to say it out loud to him because the morning had not been the right moment for that conversation. This was the right moment. I understand, she said. I'm going to be honest with you about something else, he said. The seniority issue, the hierarchy. This hospital, like most hospitals, has a system, and that system doesn't always make room for the person at the bottom of the ladder to be right when the person at the top of the ladder is moving in the wrong direction. He picked up his tablet, looked at it, set it down again. That system failed you this morning, or rather it almost failed Elena Reyes. Because of how it failed you. She had not expected this level of candor from him. She had worked with Brennan for 2 years, and she had assessed him as competent and fair and somewhat closed, the way doctors who'd been in practice for 25 years sometimes became closed. This version of him, this direct, self-examining version, was something she was seeing for the first time. Thank you for saying that, she said. I'm saying it because I want to make sure it doesn't happen again. He looked at her. Not just with you, with anyone on this floor who has something worth saying. I got comfortable with the way things work, and I stopped. He stopped himself. I wanted to be different going forward. She held that for a moment. This was a significant moment, and she knew it was a significant moment, and she wanted to respond to it accurately. I appreciate that, she said. And then, because she meant it, and because he deserved to hear it, and for what it's worth, The moment I told you about the scan, you ordered it. That matters too. You didn't let it go because you'd already decided. You heard it. Something in his posture released slightly. Eventually, he said. Eventually counts. He stood up. He picked up his tablet. He stood there for a moment, in the particular way of people who have said the hard thing they came to say and are not quite sure what to do with themselves after. One more thing, he said. Yes? The VA social worker, Bauer. Did you give Reyes her card? She looked at him. Yes, how did you? Security told me about the conversation in the alcove. He almost smiled. Not quite. You were 3 steps ahead of everyone in this building all morning, Hart. I just wanted to make sure I knew all of them. He turned to go, then stopped. Good work today. He walked away before she could respond, which she suspected was deliberate, and she turned back to the chart and sat with the weight of the last 10 minutes for a moment before she resumed typing. She had been typing for about 4 minutes when her pager went off. Recovery floor. Elena Reyes. The message was clinical and brief. Patient asking for nurse from ICU, Hart specifically. She stared at the pager, asking for her specifically. Elena Reyes had been unconscious for the entirety of their shared morning. She had never spoken to Ava, had never seen her face, had no reason to know her name, which meant someone had given Elena her name, which meant Mark or Danny had spoken to her in the recovery room. She clipped the pager back to her scrub and took the stairs because the stairs were faster than the elevator. The recovery floor was 2 levels up, and the nurse at the station directed her to Bay 7 without asking for her credentials, which told her that her arrival had been anticipated. She pushed through the bay curtain and stopped. Elena Reyes was awake. It was the first time Ava had seen her conscious, and the difference was striking in the way it was always striking when you'd watched a person unconscious and then watch them wake up, like a photograph given dimension. Her eyes were dark brown and clear, the particular clarity of someone newly returned from sedation who is working hard to understand where they are and what has happened to them. There was an oxygen monitor on her finger and an IV in her arm, and the color in her face was better, noticeably better, than it had been at 6:30 in the morning. Mark was in the chair beside the bed. Danny was standing at the back of the bed. Mark had his wife's hand in both of his, and he was leaning forward with his elbows on the edge of the mattress, in the posture of someone who has been sitting exactly like that and not moving for a significant amount of time and has no intention of moving. He looked up when Ava came in. Something in his face shifted. Elena turned her head toward the movement. That's her, Mark said quietly, to Elena. Elena looked at Ava. Her eyes moved over her with the particular focused attention of someone who is running on reduced resources, but is using all of them. You're Ava, Elena said. Her voice was hoarse from the oxygen mask. She said it like she already knew the name, which she did. Yes, Ava said. She came to the side of the bed. How are you feeling? Like something happened to me that I don't fully understand yet. Elena's eyes were direct. She had, Ava thought, the quality of a person who did not waste time on things that weren't real. Mark told me what you did. Mark's version of events may be generous. He said you caught something the doctor missed. Ava glanced at Mark. He met her gaze without apology. She looked back at Elena. The attending physician and I reached the right conclusion together, she said carefully. And then Dr. Kwan handled the procedure. What matters is that you're here and the procedure worked. Elena studied her. He also told me what happened at the checkpoint, she said. The bay went slightly quieter. Mark didn't move. Elena, he started. I want to hear it from her, Elena said. Not sharp, just clear. Ava looked at this woman who had been dying at 6:30 in the morning and was awake and asking direct questions at what was now early afternoon. She thought about how to be honest without making this moment about herself. Your husband was frightened, she said. He'd been waiting for a long time without information, And when you're trained the way he's trained and you're that frightened and that helpless, sometimes the training takes over in ways that aren't entirely intentional. She kept her voice level. He wasn't trying to hurt anyone. He was trying to get to you. Elena looked at her husband. The look that passed between them was not something Ava could fully read, because it belonged to two people who had years of private language between them, a shorthand built from time and experience that outsiders couldn't translate. "Did he hurt anyone?" Elena said, still looking at Mark. "2 security guards are going to be sore tomorrow," Ava said honestly. Elena closed her eyes for a moment. When she opened them, she was still looking at Mark. "We'll talk about it," she said. "Yeah," he said, low. "We will." It was not an argument. It was not forgiveness either, not yet. It was the acknowledgement between two people who know each other well enough to know when the right time for a conversation is. And both of them understood that the right time was not right now, in a recovery bay, 4 hours after emergency surgery. Elena turned back to Ava. "He said you've been through similar things." Ava felt the shift in the conversation. "He told you about my background." "Just enough." Elena's eyes were steady. "He said you were a medic, that you understood things about him that most people don't." "I understood his response this morning, yes." "Does that happen to him often?" Elena said. "What happened today, She paused, looking for the word, and Ava could see she already knew the word but wasn't sure she was ready to say it out loud. "Dissociation," Ava said gently. Elena nodded. "Does that happen to him often?" It was a question directed at a stranger about her husband's inner life, and it was a question that carried enormous weight. The weight of a wife who had suspected things she hadn't been able to confirm, who had watched a man manage himself carefully and wondered what was underneath the management. Ava chose her words with precision. "I can't tell you how often," she said. "I met your husband this morning. What I can tell you is that what I saw was consistent with untreated PTSD in someone who has a very high threshold for managing symptoms, which means the symptoms are real and they've been there for a while, and he has very good tools for controlling them, and sometimes the circumstances are bigger than the tools." The room was very quiet. Mark had not moved. His hands were still around Elena's. His jaw was tight in the particular way she had come to recognize as his tell, the way he held feeling in his body when he couldn't hold it in his face. Elena looked at her husband for a long moment. Then she turned her hand over so that her palm was up inside his, and she squeezed, and he squeezed back, and that small motion carried more information than anything anyone in the room had said in the last 10 minutes. "He stopped seeing his therapist," Elena said. "I know," Ava said. "He told me. I've been trying to get him to go back for 4 months." Her voice was not accusatory. It was tired. The specific exhaustion of someone who has been carrying a worry alone for a long time. "Elena." Mark's voice was low and unsteady in a way Ava had not heard from him before. Not the controlled low of the alcove conversation, but something less managed. "This is not..." "It's okay," Elena said. To him, not to Ava. "It's okay." She squeezed his hand again. "We're going to be okay, but you have to go back." He looked at his wife, at her face against the pillow, at the IV in her arm, at the monitor clipped to her finger. He looked at her with an expression that stripped away everything, all the control and the management and the trained composure. And what was underneath it was simply a man who had come very close today to losing the thing that held his world together. "Yeah," he said. The word barely made it out. "I know." Danny had been quiet in the back of the bay throughout this conversation. He cleared his throat softly. "I'm going to get some coffee," he said, and slipped out the curtain with the grace of a person who understood when a room needed fewer people in it. Ava made a move to follow him. "I'll let you two..." "No, please." Elena's hand came up slightly, not quite reaching for her but indicating, "Stay for 1 more minute." Ava stopped. Elena looked at her with that same direct, resource-conserving attention. "What do I need to know?" she said. About what happened to me. What do I actually need to understand? It was the question Ava had been waiting for her to ask, and the fact that she asked it this directly, this soon after coming out of anesthesia, told her something important about Elena Reyes. You had a blockage in one of the arteries supplying your intestines, Ava said. We don't know yet what caused it. Dr. Kwan will have more information for you in her follow-up, and there will be tests. But the procedure cleared it. Your blood flow is restored, and your vitals are strong. She paused. You need to take the follow-up seriously. The dietary changes, the medication, the monitoring. This is not the kind of thing that resolves completely without ongoing management. Do you understand what I'm saying? You're saying it's not over, Elena said. The crisis is over. The management is not. She held her gaze. But you're here. You're awake. That's what matters most right now. Elena was quiet for a moment. Then she said, How close was it? Ava had decided earlier, before she came up here, how she would answer this question if it was asked. She had decided that the truthful answer was the right one, because Elena Reyes had shown her, in 3 minutes of consciousness, that she was someone who could hold hard truths and use them rather than collapse under them. Close enough that another hour would have changed the outcome significantly, she said. Elena absorbed that. She didn't look away. She didn't flinch. She just sat with it for a moment, the way strong people sit with hard things, taking the weight before deciding how to distribute it. Okay, she said. Okay. She looked at Mark. He looked back at her. Then we have a lot to be grateful for, she said. He made a sound that was not quite a word and looked at the floor. Ava's pager went off. She looked at it. Bay 2, back in the ICU. New admission. She clipped it back. I have to go, she said. Elena looked at her. Will you come back? Before your shift ends. If I can. Ava, Mark spoke her first name for the first time. She looked at him. He looked like a man standing at the edge of something large, deciding whether to step off it. The social worker, Bauer, I called her. She had not expected that. Not this fast. Not today, with everything else that today had been. When? She said, while Elena was still in the procedure. Danny made me eat something and I sat there and I looked at the card and I called her. His voice was steady, deliberate. The voice of someone reporting a decision he'd made and was committed to, not asking for approval. She has an opening next week. I took it. Something moved through Ava's chest that she did not analyze. Good, she said. It came out quieter than she intended. That's a really good thing, Mark. She asked me on the phone what made me call today. He paused. I told her someone reminded me that I didn't have to carry it alone. The bay was very quiet. Ava looked at this man, this enormous, complicated, fractured and functional man who had come in like a wrecking ball and was sitting here 8 hours later, holding his wife's hand, having made one of the hardest phone calls a person can make. She thought about the card she had been carrying for 6 months in her own pocket. Good, she said again. She meant it in a way that went deeper than the word. She pushed through the curtain. The corridor was bright and the pager was going off again, and she had a new admission waiting in Bay 2, and 9 hours of shift still ahead of her. She walked quickly, the way she always walked when something needed doing, and she was almost to the stairwell when her hand went into her pocket. Her fingers found the card. Christine Bauer, LCSW, VA Specialist. She had been carrying it for 6 months. She had told herself it was for moments like this morning, to hand out when the situation required it. She had told herself a lot of things about why she kept it close and never used it. She stopped walking. The corridor moved around her. People passed her with clipboards and carts in the ordinary purpose of a hospital afternoon. She looked at the card, then she took out her phone. She dialed before she could make a decision about dialing, because she had learned a long time ago that with certain things, if you thought about it long enough, you found reasons not to do it. And she had been finding reasons not to do it for 6 months. And today, Of all the days she had lived since she left the Gulf, was the day that argument ran out of road. The phone rang twice. A woman's voice answered, calm, professional, warm in the way of someone trained to be warm, and also actually warm. Christine Bauer's office. Ava took a breath. My name is Ava Hart, she said. I work at St. Mercy. I was wondering if she had any availability. A pause, keys clicking. Can I ask what this is regarding? Ava looked at the card in her hand. She looked at the name on it. She thought about Elena's face against the pillow, and Mark's hands around his wife's, and the trident tattoo, and the beeping monitor, and the Gulf sand that 30 years later she could still feel between her fingers if she let herself think about it long enough. Personal, she said. It's personal. The woman on the other end of the phone said she would check the schedule, and Ava stood in the corridor and waited. And somewhere 3 floors above her, a man and his wife were sitting together in a recovery bay, being given back the time they had almost lost. And somewhere in the ICU, a new patient was waiting to be seen, and the hospital kept moving around her the way hospitals always moved, relentless and necessary, and full of the constant, unglamorous business of keeping people alive. She had done that today. She had done the things she came here to do. And now, standing in a bright corridor with a card in her hand and a phone to her ear, she was doing something she had been putting off for 6 months, something that was smaller and harder than anything she had done in Bay 4, something that required a different kind of courage than the kind she was used to deploying. She has a Thursday at 2, the woman said. Ava closed her eyes for 1 second. I'll take it, she said. She put her phone back in her pocket and walked to Bay 2. The new admission was a 67-year-old man named Gerald Potts, who had come in with chest pain and the particular gray-green complexion of someone whose heart was having a serious conversation with the rest of his body. He was frightened in the way older men who had never been sick got frightened, which was loudly, which was with a great deal of commentary about how he never got sick, and this was probably nothing, and he didn't want to be a bother, but also could someone please tell him what was happening right now? Mr. Potts, Ava said, coming to the bedside and picking up his wrist for a pulse check with the same seamless motion she'd performed 10,000 times. I'm Ava Hart. I'm your nurse. Tell me when it started. About 2 hours ago, maybe 3. It wasn't bad at first, more like pressure than pain. My wife made me come in. He looked at her with the expression of a man who was both embarrassed and relieved that his wife had made him come in. Your wife made a good call, Ava said. She worked. That was the thing about the job. The thing she had found grounding for 15 years. The way it was always right in front of you and demanding your full attention. Gerald Potts needed her now, in this bay, with his frightened eyes and his pressurized chest. And so she gave him what he needed, which was competence and calm, and the specific reassurance of a person who knew what they were doing and was doing it without panic. She had him assessed, the attending notified, and the first round of diagnostics ordered in 18 minutes. She stayed with him while they waited for the initial results, answering his questions in the direct, accessible way she'd learned was more comforting than any amount of softening language. Because people who were scared usually didn't want to be managed. They wanted to understand what was happening to them. His wife arrived 20 minutes later, a small woman named Ruth, who came through the bay curtain moving fast with her coat still half on and both hands reaching for her husband before she'd fully stopped moving. Gerald, she said, just his name. I'm fine, Ruthie, he said, with the automatic reflex of men who had been saying, I'm fine to the women who loved them for 40 years. You are not fine, Gerald. You turned gray in the kitchen. She sat down beside him and took his hand. She looked at Ava with the eyes of a woman who wanted the truth. How is he? We're getting a clearer picture, Ava said, but he was right to come in and you were right to bring him. That's the important part. Ruth held her husband's hand and looked at him with an expression that Ava recognized from 3 floors above, from a recovery bay where a woman had just come back from somewhere very far away. the particular expression of a person who is only now allowing themselves to feel the full weight of what they almost lost. Ava stepped back to give them a moment. She was updating the chart at the station when she heard footsteps she recognized. Not because she knew the person well enough to recognize their footsteps specifically, but because there were certain ways of moving through a space that were unmistakable once you'd seen them. And the particular, deliberate, controlled forward momentum that came through the ICU doors and stopped at the nurse's station was one she had spent the better part of the morning decoding. She looked up. Mark Reyes was standing at the station. He had changed his shirt, which told her that Danny had made a supply run at some point, and he had the look of a man who had eaten something and drunk water and was functioning on the particular fuel of relief and exhaustion combined. He was not taking up the same space he'd taken up this morning. Something had been released in him, some of the compressed energy that had made him feel, 8 hours ago, like a pressure vessel with a failing seal. "She's sleeping," he said. "That's the best thing for her right now. Danny's with her." He leaned against the station counter, not in an intrusive way, just the lean of someone who needed something to hold him up for a moment. "I wanted to come down before you were gone. My shift doesn't end for a few more hours. I know, but I wanted to come anyway." He looked at the nurse's station, at the organized chaos of charts and clipboards and the soft beeping of monitors in the surrounding bays. "This is what you do every day." It was not quite a question. "Yes," she said, 12-hour shifts. Usually 12, sometimes longer. He was quiet for a moment, looking at the space, taking it in. "And you've been doing this for how long? Since the VA?" 6 years at the VA, 2 here. Before that, I did some traveling nurse work. She kept documenting as she talked, the professional multitasking that became second nature. "And before all of that, the deployments." "How old were you," he said, "when you went over?" 26 on the first one, 28 on the second. He did the math visibly, the brief mental calculation that told him she was in her mid-50s now, which meant the Gulf War was 30 years behind her, and also clearly 30 years not behind her. "I was 23 when I went through Buds," he said, not showing off, just sharing, meeting her honesty with his own. "Made it through on the 3rd try." She looked up from the chart. 3rd try is the one that counts. Something like the beginning of a real smile moved across his face. Not a full smile. He didn't seem like a man who arrived at full smiles easily, but the motion of one, the start of it. "Elena wants to know if you'll come back up," he said, "before you leave for the night. She said she has things she wants to say to you. Tell her I'll try, genuinely, if the floor allows it." He nodded. He straightened up from the counter, and she could see him preparing to go, the gathering of himself for the return trip upstairs. And then he paused. "The guards," he said, "Rodriguez and the other one. Do you know how they are?" She set her pen down. "Rodriguez has a bruised shoulder. The other one, Patterson, has a bruise on his hip where he hit the wall. Neither of them required medical attention." He received that with his jaw set. "I need to talk to them." "You need to talk to them," she agreed. "Today if you can. I know where the security office is." A pause. "I've been thinking about it all afternoon. What to say." He looked at his hands briefly, the hands that had picked up a man by the collar at 6:30 in the morning. Jigay set the events of this entire day in motion. "I don't have a good explanation." "You don't need a perfect explanation," she said. "You need an honest one, and you need to be willing to hear whatever they have to say back." He looked at her. "Will that be enough?" he said. And she understood he was not asking about the guard specifically. He was asking something larger, the question that was underneath everything, the one that had been running since the moment he came back into himself at that window and understood what he'd done. She chose her answer carefully. "It's the only thing that has a chance of being enough," she said. "There are no guarantees, but showing up and being honest is where it starts." He held that for a moment. Then he nodded. Once, the same decisive nod she'd seen from him in the alcove this morning, when she'd asked him to take a step back from the window. "Okay," he said. He pushed off from the counter and walked back toward the doors, and she watched him go with the particular feeling of watching a process that had started in chaos, beginning to settle into something that might, over time, become solid. The ICU doors swung closed behind him. She turned back to her chart. Gerald Potts turned out to have a significant blockage of his own, a 60% occlusion in his left anterior descending artery, the Widowmaker, as it was known, which was a nickname that existed because of how efficiently it could do exactly what it sounded like. The cardiologist on call, Dr. Ventura, arrived at 4:17, reviewed the imaging, and scheduled Potts for a cardiac catheterization the following morning, with the brisk efficiency of a man who'd seen this before and knew exactly what to do with it. Ruth Potts took this information the way a person takes information when they have been scared enough to prepare themselves for the worst, and the worst turns out to be something addressable. She held her husband's hand and asked 3 precise, intelligent questions, and Ava answered the ones that were hers to answer and told her the ones that were Dr. Ventura's to answer would be coming. "Will he be okay?" Ruth said, directly to Ava after Ventura had stepped out. Ava looked at Gerald Potts, who was watching his wife's face with the expression of a man who was trying to look unconcerned for her sake and was not entirely succeeding. "The procedure tomorrow has a very high success rate," she said, "and you got him here before the blockage caused damage. That's the thing that matters most." She paused. "He's going to need to make some changes after this. Diet, exercise, medication. That conversation will happen with his cardiologist. But he's in the right place, at the right time, with the right information." Ruth nodded. She turned back to her husband. "Do you hear that, Gerald?" "I hear it, Ruthie. Changes," she said. The word carried 40 years of context. "Changes," he agreed. He turned his hand over under hers, the same motion she'd seen 3 floors up between 2 entirely different people, palm up, an offering, and she put her smaller hand into his. Ava stepped out of the bay and stood in the corridor for a moment. The day had been, by any measure, one of the more significant days of her 2 years at St. Mercy. She had known that since approximately 7 in the morning, since the moment she'd followed a gurney through a door without being asked. But standing here now, with the afternoon light going gray outside the windows she couldn't see, but could feel in the quality of the corridor's fluorescence, she understood it differently than she had understood it at 7 in the morning. Not as a day that had tested her, as a day that had changed something. She went to find Dr. Brennan. He was in his office, which was a small room off the main ICU floor that he used for documentation and the particular kind of administrative misery that came with being an attending physician. The door was open. She knocked on the frame. He looked up. "Hart, I have something to say," she said. "If you have 2 minutes." He put his pen down. "Come in." She came in. She did not sit down. She stood in the middle of his small office and looked at him directly. "I should have told you about my background when I hired on," she said. "Not for my benefit, for the patient's. There have been situations in the last 2 years, fewer than today, but situations, where what I know from the field would have been relevant, and I held it back because I was concerned about how it would be received." She paused. "That was the wrong call, and I want you to know I understand that now." Brennan was quiet, looking at her. "What made you hold it back?" he said. "The VA," she said. "I had an experience there. A physician who found out my background and decided it meant I was managing things I shouldn't be managing. It was said more professionally than that, but that was the substance of it." She kept her voice even. "I came here and started clean, and clean, I found, was easier." Brennan looked at the desk for a moment, then at her. "That shouldn't have happened to you," he said. "At the VA." "No," she agreed, "it shouldn't have. It's not going to happen here." He held her gaze. "I want that to be clear." She looked at him. She measured the statement, measured the man making it, measured the morning that had produced this moment, and found, to her own mild surprise, that she believed him. "Okay," she said. "Heart." He stopped her as she turned. "Tomorrow, I want to sit down with you and the nursing director. Not about this morning specifically, about your background and how we use it going forward. Properly, with documentation and with protocols that protect you and the patients both." He paused. "Would you be willing to do that?" She stood in the doorway of his small office and looked at this man who had been her attending physician for 2 years and had, on this particular day, surprised her. "Yes," she said, "I'd be willing to do that." She walked back to the floor. At 6:40 in the evening, 1 hour before her shift ended, she took the elevator to the 3rd floor. The recovery bay was quieter than it had been in the afternoon. The lights had been dimmed to the level appropriate for a patient who needed rest. And Danny Reyes was gone, which meant he had probably been sent home to sleep. Mark was in the chair beside the bed. He did not appear to have slept and did not appear to intend to sleep. He looked up when she came through the curtain. Elena was awake. She was more awake than she'd been in the afternoon, the sedation more fully metabolized, her eyes clearer and her voice stronger when she spoke. "You came back," she said. "I said I'd try." Elena looked at her husband. Something passed between them, and then Mark stood up. "I'll give you 2 a minute," he said. He looked at Ava as he passed her. "Thank you," he said. Again, the same 2 words he'd said in the recovery bay doorway that afternoon. But they landed differently now, heavier and more specific, like he'd been thinking about what they meant and was saying them again because the first time hadn't been enough. She nodded. He slipped through the curtain. She came to the bedside and sat in the chair he'd vacated. Elena looked at her in the unhurried way of someone who has spent a day being returned to herself and is now taking stock of what surrounds her. "He went to see the security guards," Elena said. "I know, I heard." Rodriguez shook his hand. She paused. Patterson was harder, but Mark stayed there and took it until he was done saying what he had to say. Her voice was steady, factual, but underneath it ran something proud and something sad in equal measure. "That's who he is when he's himself. The thing this morning, that's not him." "I know," Ava said, and she did know. She had seen both versions in the span of a single morning, and she understood they were not contradictions. They were the same person, the same force, pointed in different directions by different circumstances. "I want to ask you something personal," Elena said. "Go ahead." "How long did it take you?" She held Ava's gaze. "After the deployments, to be the person you are now, however you are now." It was the most direct version of the question anyone had ever asked her, not the circling, careful approach of people who were afraid of offending her, just the straight line from point to point. She thought about the true answer. "Years," she said, "not months, years." And it wasn't linear. Some years were better than the one before, and some years were worse. She looked at her own hands for a moment. "What I can tell you is that the years I was in therapy were the years that moved forward, and the years I was not were the years I stood still or went backward." Elena absorbed that. "He's been standing still for a long time," she said quietly. "I know." "I knew it, and I didn't know how to." She stopped. "I didn't want to push him somewhere he wasn't ready to go." "That's not on you," Ava said. "You can't want it for someone more than they want it for themselves. All you can do is be there when they get there." Elena was quiet. "Where did you learn that?" "The hard way," Ava said. "The same way everyone learns it." Something in Elena's face softened. Not collapsed. She was not a woman who collapsed, but softened in the specific way of a person who has been braced for a long time and has just been given permission to set something down for a moment. "Thank you," she said, "for today, for all of it, for following the gurney or whatever it was that made you." "I don't know exactly what made me," Ava said honestly. "Something told me to look twice, so I did." That something saved my life. The simplicity of the statement landed in the room, and neither of them tried to add anything to it, because it was complete as it was. They sat together for a moment in the easy quiet of two people who had been through something together, even if their experience of it had been profoundly different. One conscious, one not, one moving through the crisis, one moving through it. The particular kinship of a shared day. Then Elena said, "Mark told me you made an appointment." Ava looked at her. "He told me you both called Bauer today," Elena said. The corner of her mouth moved. He seemed, she searched for the word, relieved, that he wasn't the only one. Ava had not expected Mark to tell his wife that. She sat with the surprise of it for a moment and found, underneath the surprise, something that felt like the specific warmth of being known by someone who has no reason to know you except that the day gave them one. "He shouldn't have shared that," she said, but without heat. "He thought you wouldn't mind." A pause. "Were you upset?" She thought about it honestly. "No," she said. "No, I wasn't." Elena nodded. She looked at the curtain in the direction Mark had gone, with an expression that held everything she felt about him in the concentrated form of a single glance. "He's going to be okay," she said, half to herself, half to Ava. "He just needs someone to hold the door open long enough for him to decide to walk through." "He walked through it today," Ava said. "Because of you." "Because of you," Ava said. "Because you were on the other side of that glass and he needed to get to you. I was just the person who showed him how." Elena looked at her for a long moment. Then she reached out and covered Ava's hand with hers. It was a brief contact, light, the gesture of someone who did not have excess energy to spend on gestures, but was spending it anyway because the moment required it. "Go home," Elena said. "Sleep. My shift ends in an hour. Then finish your shift and go home and sleep." A pause. "And go to your appointment on Thursday." Ava stood up. She looked down at this woman who had arrived at St. Mercy before sunrise, in a body that was quietly failing and was now, 8 hours later, giving her instructions. "You're going to be fine," Ava said, and she meant it the same way she had meant it this morning when she'd chosen the word when, with the same precision, with the same deliberate weight. Not a comfort, a fact. "I know," Elena said. "I've had a good day for evidence." Ava smiled. A real one. The kind that came from somewhere genuine and arrived without effort. She pushed through the curtain. Mark was in the corridor, leaning against the wall with his arms crossed and his head slightly bowed, and he straightened when she came out. She stopped. They stood in the corridor together, and for a moment, neither of them said anything, because there was a kind of conversation that had already happened between them over the course of the day. A long and complicated conversation made of actions and pauses and true things said under pressure, and it had covered most of the important ground, and what was left between them now was something simpler. "You told her about Thursday," she said. He met her eyes without apology. She needed to know she wasn't the only one trying to get somewhere. She thought about that, about the particular generosity of it, the willingness to use his own vulnerability as a gift to his wife's peace of mind. "Fair enough," she said. He put out his hand. It was a simple gesture and a large one. The same hand that had closed around a security guard's wrist at 6:30 in the morning. The same hand that had pressed flat against the glass, searching for his wife through it. The same hand that had held Elena's palm in both of his all afternoon. She took it. His grip was what she'd expected, firm and deliberate, and she shook it once and let go. "Ava Hart," he said, as if testing the name, as if saying it this way for the first time. "Mark Reyes," she said. He nodded once. The nod that was his full-stop punctuation, the gesture that meant said and done and understood and moving forward. She turned and walked toward the elevator. The shift ended at 8:17, which meant it ran 17 minutes past schedule because the second shift nurse came in late, which was not unusual. and Ava used the extra 17 minutes to complete the last 2 chart entries and hand off Gerald Potts's case with full notes and a personal verbal briefing, because Potts was going into a catheterization at 7 in the morning, and the incoming nurse deserved to walk into that with complete information. She changed out of her scrubs in the locker room and sat on the bench for a moment. The locker room was empty. The fluorescent light above the sinks buzzed very faintly. Her feet hurt in the specific way they hurt after 12 hours of constant movement, the particular settled-in ache of a body that had been useful and was now asking for rest. She thought about the morning. She thought about the gurney she had followed through the double doors for no reason she could fully explain. She thought about Elena's color against the pillow, and Brennan's hesitation, and the moment in the IR suite when the occlusion gave way and the blood moved through the artery the way blood was supposed to move. She thought about a trident tattoo on a forearm and a hand pressed flat against a piece of glass, and a man who had come in like a storm and gone out like someone who had remembered that they were more than the storm. She thought about a card she'd been carrying in her pocket for 6 months. She thought about Thursday at 2. She put her bag over her shoulder and stood up. The walk to the parking garage was 5 minutes, through the main lobby where the night shift was settling in, and the overhead lights were doing their particular nighttime thing. Less harsh, more yellow, the hospital adjusting its own atmosphere for the hours of darkness, the way a living thing adjusts its rhythms to the time of day. She passed the main reception desk. The woman behind it, a night shift receptionist named Joan, who had been at St. Mercy for longer than anyone seemed to know, looked up as Ava passed. "Heard it was quite a day," Joan said. "Heard from who?" Joan smiled. "Honey, in this building, everything gets around by dinner." She tilted her head. "They're saying you saved that woman, the one with the vascular thing." "The whole team saved her," Ava said. "That's not exactly the version I'm hearing." Ava shifted her bag. "The version you're hearing isn't wrong," she said. "It's just incomplete." Joan looked at her with the particular knowing expression of a woman who had watched people walk in and out of this lobby for 20-plus years and had developed opinions about all of them. "You're a strange one, Hart," she said, not unkindly. "So I've been told," Ava said. She pushed through the lobby doors. The night air was cool, and she stopped for a moment and breathed it, the way you breathe air after a long time indoors. The particular relief of open space after hours of contained, managed atmosphere. She stood there for a moment and looked at the sky, dark and full of the city's ambient glow. No stars visible, but the sense of them there behind the light. She had come to Street Mercy Hospital 2 years ago, looking for something quieter than the VA, something that would let her do her job without the particular specific weight of a veteran population who reminded her every single day of things she had not fully learned to set down. She had thought that civilian nursing would be simpler. She had not thought it would be boring. She was not a person who sought boredom, but she had thought it would be contained in ways the VA had not been contained. She had been, she understood now, incorrect about that. You could not outrun the thing you carried by choosing a different room to carry it in. You could only go to Thursday at 2 and learn, finally, to put it down without losing it. She started walking to her car. Behind her, in the building she had just left, a woman named Elena Reyes was sleeping with her husband's hand around hers, moving steadily into the recovery that had been made possible by a 5-minute window of correct information and a nurse who had been in the right place to deliver it. And a man named Mark Reyes was sitting in a chair beside that bed, awake, watching the monitor, listening to the steady, rhythmic confirmation of a heartbeat continuing, which was, as a very tired nurse had told him in a different context 14 hours earlier, the only thing that needed to be true right now. And a woman named Ava Hart walked across a parking garage in the night air with the weight of a long day in her feet and something lighter than usual in her chest, carrying 30 years of a story she had been telling herself in pieces, finally beginning to understand that the whole of it, the gulf in the field hospital, in the VA, in the 2 years at St. Mercy, in the cracked drywall, in the glass window, in the trident tattoo, in the Thursday appointment that was now 4 days away, all of it was the same story. And the story was not finished. And that was not a problem. That was the point.